Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Basic water, sanitation and hygiene services are key to healthy living. Unfortunately, only 10% of Nigerians have access to these services. About 48 million Nigerians also still practice open defecation. Today on Sound Health, we will take a look at the impact of open defecation and how to end the messy business in the country. Stay tuned. The conversation begins after this break.
World Toilet Day was created by the United Nations, a group of 193 countries which work together to promote peace, safety and equality around the world. It takes place each year on the 19th of November to highlight the importance of clean, safe toilets and good sanitation such as hand washing facilities. Around the world, almost 1.7 billion people don't have a decent toilet. That's more than 1 in 5. They have no choice but to use dirty, unsafe toilets in pits, or to go outside in bushes or rivers. This means that there's human waste out in the open, polluting water sources that people drink from and wash in, and spreading deadly illnesses such as diarrhea and cholera. Without somewhere to wash one's hands after going to the toilet, disease spreads even faster. Due to these diseases, children are forced to miss school and adults are unable to earn money to provide for their families. One of the United Nations goals is to ensure that everyone, everywhere, has access to a decent toilet, including hand washing facilities, by the year 2030. WaterAid shares this goal. To achieve it, we must help people to build new toilets and spread the message about good sanitation. We have already reached 27 million people with decent toilets, but there is still a lot to do. World Toilet Day is a chance to work together to ensure that everyone, everywhere, has a decent toilet. What will you do to make a difference?
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Jamiu Ganiyu, a consultant public health physician, and he is going to tell us or explain to us, recommend how to end open defecation and as well as address the health impact of this trend in Nigeria. Good evening, Dr. Ganiyu, and thanks for joining us.
Good evening. It's a pleasure being with you this afternoon.
All right. The importance of basic water, sanitation and hygiene services cannot be overemphasized. Unfortunately, we hardly have enough structure in place to accommodate that in the country. What is the impact of this, and let's start from that. Let's know the impact of this.
The impact of lack of access to water, sanitation and hygiene is actually very huge. And if you want to relate it with the issue of open defecation that is in current menace in the country, I think it really has a lot of impact. When we look at the social aspect, it is actually giving us a negative stigma internationally, and also looking at the environment where such practices is taking place. Open dumping site is not something to look at. In terms that give a kind of aesthetic eyesore, issue of foul smelling, pollution of air and so on. So that is air pollution. And also on the aspect of health, we found that is why we keep having cholera outbreak in every year. And I want to attribute one of the idea of open dumping to one of the major factors because of the idea, cholera is transmitted through fecal oral. So with open dumping, everything can get contaminated, water, inanimate materials in our homes and so on. And also flies and other can also serve as a mechanical barrier. Apart from transmission of infection on the earth ground, It can also transmit soil transmitted immunities, such as hookworm and others. So these are some of the area. And also in terms of economy dimension, it also by a kind of investing in building of toilets, we may encourage employment of labor as well as purchase of material to construct toilets and other sanitary equipment. So it really has a lot of huge impact, especially if such kind of practices is not observed in the country.
Okay, Dr. Ganiyu. Why would people take up this practice? There is a particular road, major road in the southwest. Before commissioning, the stretch of a particular section of that road has been designed, let me just use that way, has been designed with open defecation and all that. Why must people take up this practice? Why do we have this urge to do that?
Up this is one thing that has to do with ignorance and that primitive beliefs, ideas, that is common with us. Those days when before we came into the era of civilization, the practice has been open dumping, that they are defecating in the bush and so on. So I want to believe that's one of the major factors. Another thing has to do with access to water and sanitation, because when people, majority of homes these days, you find that it's only those who can afford boreholes and all that. The idea of having the normal water networking as in the urban setting is no longer there. So when people build their homes, it's only those who can afford boreholes. So lack of access to water is one of the major things. And apart from that, even where there are toilets, lack of maintenance also is another factor, in the sense that maybe when you get to a toilet and you find everything looking unhygienic, people will not want to use such kind of facility, so they will prefer to go for the open dumping practices, which is not the ideal. Another really thing is that we don't have adequate number of toilets. For us to achieve the roadmap, that is a roadmap for open dumping free for 2025, that you need to build more toilets, and that it is the responsibility of both public and private sector. For instance, that it has been estimated that for us to be able to achieve that target, government need to build about 3.9 million toilets every year. The current one in the country is about 180 to 200, which is far below
shortfall.
The annual target. That is so we need to do that. And another reason why people also practice open dumping is the fact that some of there is no law. Our law and legislations are not adequate. It is only in Nigeria you see that some people will build malls, they will build shops, they will build markets, and there are no sanitary facilities. For instance, just go around the computer village and around Ikeja now. You see some shops and all that. When you ask where is the toilet, they don't have. So these are some of the reasons why that. So we need to kind of either review or improve our building laws. That wherever there is any building, there must be what? Facility for sanitation. So these are some of the reasons. We need to develop technology innovations for different models of toilets, especially in the rural areas where we know that they don't really have access to water and so we need to develop something, that can take care of such factor, so that such can be, provided in such setting. And also, we need to also engage with the private sector as part of corporate responsibility to help us also in providing toilets. It can be mobile toilets in some of our institutions, malls, public places, and so on. I think those are some of the ways, if we can, it may help in a kind of reducing the current bad practices of open defecation.
All right, Dr. Ganiyu, you in your response, you pointed out that we still need to work on getting more toilets. But the few we have the few public toilets we have, public toilets we have, we see people paying for this toilet. Is this norm right? Are public toilets expected to be commercialized?
That's why when I mentioned provision of toilets should be free. That is another area actually government need to look into. you can't be making people to be paying for that. That will discourage. We need to stop that practice if actually we want to achieve our target by 2025. Because some people cannot afford the amount they pay, and because of that, they result into open dumping and so on. So these are areas actually that also government need to discourage such kind of practices. Thank you.
Okay, aside open defecation, another challenge is proper hand washing. About 23% of Nigerians lack access to basic water, let alone practicing clean hand washing.
The way to go, as I've said, I remember if there are no emergency, the people don't take it serious. And also, you have to understand the idea of how Nigeria has to do with behavior, individual. So the only thing we can do is to continue to create awareness, and also, apart from creating awareness, we also need to ensure that in all those public spaces, we make provision for some of these hand sanitizers, hand washing materials and so on, just like what we did during COVID-19 pandemic. So I think unfortunately, it's really unfortunate that if there are no emergencies, there are no push factor, we don't take this serious. But ideally, this kind of practice ought to be part of us on a daily basis. But I think the only way keep on creating an awareness, and that's why we have what we call hand washing day, which is normally launched sometime in October 4th or 5th. So the only way we can do is to continue to sustain the awareness that has already started regarding issue of hand washing, and also we need to continue to partner with UNICEF, which is responsible for the wash intervention. So those are different ways. Apart from UNICEF, other stakeholders need to come on board. I mentioned the private sector and other relevant stakeholders need to also support this cause by providing their own support, which can be material, and it can be a form of creating awareness and so on, so that people can take it as a form of social responsibility, and also for the benefit of their individual health.
Okay, apart from the health impacts now, the World Health Organization says children, women and girls are mostly affected by open defecation and lack of basic wash services. What are your thoughts on this, and how do you think this group of population can navigate through these challenges while we wait for solutions?
Yes, the solution, looking at these are like vulnerable group, meaning that the design of toilets should also factor children. We should not just develop a kind of design that only look at adults, or just without taking cognizance of gender and so on. Even the people that have disability also need to be factored. That is why when you visit other climes where such kind of consideration have been made, you find that they have provision for children toilets, they have for those that have provision for those that have disability and so on. So I think the way to go, as I've said, is that we need to improve on our technology innovations so that it can actually capture this vulnerable group of people in terms of the designs of toilets in the public space and in other institutions.
All right, your call to action as we wrap up now, Dr.
Okay, my call to action, as said, is for us, we are in 2023 at the moment, and we are hoping to achieve open defecation free by 2025. Based on statistics, instead of us to be recording a kind of decline, we are even recording more cases of such. In 2017, it was 46 million people. In 2019, 2021, it was 48 million. But we don't know. Currently, it has been estimated that about 50 million Nigerians still practicing open defecation. So I think if really we want to meet our target, there is need to continue to sustain that public awareness. And in doing that, we must do that in public space, in every channel that we think can get to the grassroots. And also, in trying to create public awareness, they need to also involve opinion leaders, change agents, or advocates, like using our politicians, our opinion leader in the society, so that they can also serve as advocates of media and so on. We can even use musicians to let them know about the danger of open defecation. I think we can achieve that. And also, as part of that, government need to take its responsibility by ensuring that they provide more toilets, which is free, not about commercializing it that I mentioned earlier on. We have to make provision for that, and we must enact law, or if it is there, we must be strict on that law that ensure that for in every building, whether it's a mall, whether it's an institution, whether in the market, there must be adequate provision of toilets, if that is the way to go. And again, in giving building approvals, they must ensure that the issue of toilets is well taken care of before such approval is given. And also, our environmental health officers need to wake up in terms of performing their responsibility. There should be proper inspection of homes, because it has been estimated that about 10 million households are also practicing open defecation. So they need to carry out their roles and responsibility in terms of carrying out routine inspection of homes, buildings, and so on. And when they find anybody wanting, such person need to be what? Must be penalized. Such person need to be prosecuted and so on. And also, apart from our building and so on, also there will be, especially in open spaces, there will be other, agencies which also need to ensure that wherever they come across any person practicing such kind of behavior, such person need to be arrested and prosecuted. Without using people as an example, I don't think people will be ready to actually effect that change. So I think these are some of the areas I think we can look for. And also, in terms of providing, whether for us to actually have the target, we must also build more toilets. We must build more toilets in the public place and in our parks. And where it is appropriate, we must ensure that we have toilets. And also, as I've said, the government cannot do it alone. The private sector need to be engaged as part of their corporate responsibility in ensuring that they provide free toilets for citizens. I think through this approach, I think we can achieve a lot in terms of meeting our target of making open defecation free by 2025. Thank you.
Achieving a society free of open defecation is possible. Dr. Jamiu Ganiyu, consultant public health physician, thank you so much for your thoughts on ending the messy business in Nigeria. Sound Health continues with trending health report from around the world. Please stay tuned. The projection of achieving open defecation free by 2025 is possible. It is realistic if only we all end the practice, if only we adopt healthy and hygienic practices. Let us end the messy business in Nigeria. For comments and inquiries, or you have topics you would like us to treat, send SMS to 0035826603 or follow us on social media at TLTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.